Hi, it's Dr. Webb.
Hey, Dr. Webb, Dr. Bryce would like to speak with you. This is Rhonda with Downtown Baptist ER.
That's crazy. As soon as I said I haven't got any phone calls today, get a call from the ER. Thank you to the sponsors of this video who sent me one of their countertop reverse osmosis water purifiers, aquibear. Using a 3-stage reverse osmosis filter system, aquibear removes over 99% of impurities that could be lurking unseen in your water, such as chlorine, bacteria, microplastics, heavy metals, and contaminants. The system improves water for drinking, cooking, and other important uses. It comes with a purified water tank that is slim and detachable, which can easily be stored in a fridge. If you're in search for a reverse osmosis water purifier, definitely check out aquibear. All right, guys, it is 6:45 a.m. I just woke up, about to head to my office. I have a very busy week this week. You guys are going to follow along. First of all, I have my normal spine practice. As an orthopedic spine surgeon, I see patients with neck pain, low back pain, with arm pain, with spinal pathology, and I take care of these patients sometimes who have really complex spinal conditions. And then in addition to my spine practice, as I'm growing it, I'm a little less than a year out of practice, I also take general orthopedic trauma call. So I'm on call this week, starting here in the next 15 minutes for a whole week. So, and it's usually busy, very busy call. So I'll see patients with fractures of their hip, fractures of their ankle, infections, tendon, multiple skeletal problems, whatever comes in the ER. The hard part is trying to see these patients and plan for these surgeries in addition to my normal schedule. So today I have clinic, which means I see patients in my office, and plus I'm heading to the operating room to assist one of my partners in one of his cases. So that's a big case that we have this afternoon that starts at 1. In addition, I have a talk that I'm giving at 12 o'clock today to some chiropractors. And then later this week, my wife doesn't know this just yet, but her mom is coming into town to surprise her. My son turns 2 later this weekend. My dad is coming in town this weekend, so very busy week. I'm gonna let you guys in on how it goes. Orthopedic trauma surgery and a spine surgeon on call this week. You guys are gonna check it out. Let's go. All right, so I'm just finishing up for the day. It's about 6 p.m., just getting home. Today was pretty much uneventful from a trauma standpoint perspective. I haven't gotten any phone calls yet, which is makes me really nervous. Usually when I'm on call, I'm checking my phone every 5 minutes or so to make sure I didn't miss any phone calls, but that just means that the rest of the week is about to be pretty busy. Today I had clinic. Hi, it's Dr. Webb.
Hey, Dr. Webb, Dr. Bryce would like to speak with you. This is Rhonda with Downtown Baptist ER regarding a patient in the ER. Do you need anything from me regarding this patient? 300-807.
Okay.
Okay, let me put you on hold, please, and thank you.
Thank you. That's crazy. As soon as I said I haven't got any phone calls today, get a call from the ER. We're gonna see what this is. That's why you should never say it's not busy or, man, it's slow today. Soon as I pull up at home, as soon as I say that haven't gotten any
Hello,
calls.
this is Matt Bryce. How are you?
Hi, is Dr. Webb?
Hey, just wanted to bring you on board for a patient I'm bringing in with a diabetic foot wound, 53. The wound is over the right MTP, plantar aspect of the foot. A little bit of kind of tunneling in this ulcer, but she also has a non-displaced fracture of the fifth metatarsal on the other side. So nothing that looks contiguous as far as where this wound is or that. She's got a lot of neuropathy of the feet, so she doesn't know of any specific trauma. But it looks like this is a diabetic wound that we're going to be able to treat. I don't think this is headed towards amputation the way it looks right now.
Okay, so what is the point of getting orthopedics involved if you're going to treat it without surgery?
That's a good question. So I don't think that that's going to need probably surgery from a foot standpoint.
Yeah.
I don't know. If you want to take a look at the x-ray if you're able to and sign off on it, I will let medicine know.
Yeah, I'm happy to take a look at her. And what are the inflammatory markers?
Let me get those for you here. Stable at this point. She's got a normal white count. Has had fever, chills, outpatient, and tachycardic on arrival.
What's her ESR CRP?
I will get those. They're ordered, just pending still.
Yeah, and that's another thing. When you guys call for like a diabetic foot ulcer, I mean, you should have the complete workup, like and ESR, CRP, and all that. So that helps me make my decision of whether this is something that needs urgent attention or like local wound care. So, just FYI. All right, thanks.
Okay, appreciate it. Thanks, Dr. Webb.
Come on, man. If you working in the ER, don't call a surgeon for something that's not surgical. You're calling me for a ulcer on the foot. You don't have the complete workup. I need infection labs. Hey, is this patient sick? I mean, crazy. But check it out and see what it is. Alright, so I have a fracture of the patella. I got called about this last night. It's a gentleman who fell at home and has discomminuted, which means in a lot of different pieces. Displaced, which means it's a part fracture of the patella. I need to put some screws and wires and this really strong wire called fiber wire to reconstruct it. About to get started here soon. Alright, so we just finished the case. It went well. Pretty difficult case. There was a lot of different pieces that I had to put back together, a lot of fragments, but came together well, I think, and I think he'll do well. So right now, just put some orders in for a patient, his medications, antibiotics, and then also call and update his family, which I'm about to do now. Hi, this is Marmina. Hi, this is Dr. Webb, one of the orthopedic surgeons here at Downtown Baptist Hospital. Yeah, no worries. We just finished. Everything went well. All right, so I just got to the second hospital for today. I have 2 surgeries at this hospital. These are surgeries that my senior partner has, posterior cervical fusions and decompressions, which I'll be giving him a hand. And for a lot of the bigger surgeries, we kind of work together, and these are, especially spine surgery, these are 2-man operations or 2-woman operations. So it usually requires 2 people for these bigger procedures. That's why we usually help each other. And then I just got a call from the ER, from the trauma, about another gentleman who got hit by a car, and he has an ankle fracture. So he broke 3 parts of his ankle. I have to reconstruct his ankle. The problem is that I have a busy schedule tomorrow. I'm in the office all day tomorrow. I have like 25 patients to see, and I just don't have time to do it tomorrow. Saturday's my son's birthday. I'm not trying to work on my son's birthday, so I'm gonna do his surgery tonight. It's scheduled for 8 p.m. and it's gonna be a long night, but life of a orthopedic surgeon on call. So it's about 7:15 p.m. I just left the hospital that we had the 2 cervical surgeries, posterior cervicals. It went well. Here at the trauma hospital where I take call at, I have a case that starts hopefully in the next 45 minutes. I got a text from the OR stating that they were running a little bit behind. All right, so it is around 10:45 p.m. This is the time here, Thursday. Just finished with my trauma case. Basically, the gentleman who got hit by a car, his fracture was in multiple different pieces. His ankle was in multiple different pieces, so I had to reconstruct it, and I think I put like 11 or 12 screws, a little metal plate to basically reconstruct his ankle there. So you can see all those screws to put those bones back together there. And he can't place weight on this for about 2 months or so. And then I'll just follow him back up in my office for a few months, make sure this is healing fine. But everything went well. So I'm about to put some orders in for him, medications, and also some therapy requests, get him up on some crutches, and hopefully try to get out of here. Probably get home around 11, a little bit after 11, wake up at 4:35 and do it all over again. So life as a orthopedic surgeon who takes trauma call. All right, guys, it is around 7:15 a.m. Just got to my office. Had an early morning this morning. Got home late last night. Got about 5 hours of sleep or so, and then back at it again this morning. So today I have office, which means seeing patients in clinic, and then I just got another trauma consult. Gentleman who fell at the nursing home and has a hip fracture. So I have to figure out when I'm going to fix that his hip fracture, and probably some point this weekend. So busy day today. I think we're seeing 25 or so patients in office. So I'm just about to catch up on some paperwork here, some notes, some charting, and get my clinic started here shortly. All right, so it is Sunday morning. It's around 9:30 a.m. I am heading to the hospital. I have 2 surgeries today. One is a gentleman who has a hip fracture that I got a call about a few days ago that I'm going to put a metal rod and some screws to fix his hip. And the other case is a gentleman that I've operated on about 6 months ago, like way back in January. He presented with an infection in his spine, so I'm just going to go ahead and take care of that today. Sometimes I just don't know why certain patients, especially this 6 months after his surgery, he came back with what's called an epidural abscess, which is an infection in the epidural space, which is right on top of the spinal cord. So I'm gonna go in and decompress him, take the pressure off of it, and make sure he gets the appropriate treatment. You know, for this patient, I got a call from the ER that last night around 2 o'clock in the morning. So, but life of a orthopedic surgeon on call. So I just got to the second hospital here. First case went okay. This case is a hip fracture. A gentleman came in 2 days ago with hip pain after he fell at the nursing home. So about to put a long metal rod into his femur to fix his hip fracture. So about to get started here soon. It's about 3:30 p.m. They're just rolling the patient to the operating room. They have to get him asleep, get him draped out, sterile kind of dressing, and we'll get started hopefully here in the next 45 minutes or so. All right, so it's around 4:45 p.m. here on Sunday. Hopefully I just finished my last case for the week. Hopefully today and also for the week went well. Did a hip, it's called cephalomedullary nail. It's essentially where I put this metal rod on the inside of the bone to kind of stabilize the fracture. This is how it looks here. So that's a metal rod that goes on the inside of the bone. This implant will stay in place forever, and this allows us to get the patient up to start walking again after a hip fracture, which is good. So hopefully I have a uneventful rest of the day and to complete my call week. The week ends tomorrow at 7 a.m. So I have about a little more than 12 hours remaining on call. But hope you guys enjoyed this week with me. It was a blast. Had a lot of fun. Did a lot of surgery. Saw a lot of patients, and hopefully it gave you guys some glimpse into what it's like to take trauma call as an attending. Hope you guys enjoyed, and we'll see you on the next one.